So as part of our continuing education program, Siskin Hospital looks to bring in a variety of courses that, again, bring evidence-based care to all the types of patients that we see. So we treat neurologic patients, we treat orthopedic patients, we treat patients who have spinal cord injuries. And so when we were selecting topics for this year, we really were looking for some motor learning and gait training and some upper extremity motor recovery type training. And so and we had a considerable portion of our inpatient and outpatient and satellite campus physical and occupational therapy staff attend the course. And in addition to doing coursework-based didactics, they did a number of labs, initially kind of using each other for training, but then we also had one patient agree to participate as a lab subject, and so that they could practice and apply some of the techniques that they were learning with Dr. Mauder on an actual patient. The course was a two-day weekend course, and I heard from them over the weekend about how they were excited to begin using that on Monday. And so I think as soon as the very first day of therapy, the next day, they were all applying the techniques that they had learned over the weekend.
As soon as I saw these techniques being demonstrated, I knew that I would be able to use them day one as soon as I got with my patient. It gave me more ideas of things that I can do with my patients to help get them back to a functional, independent level. And just knowing, having some idea in your mind of when you're doing the class of, I'm seeing this patient right now and this would work, this technique would be really good for them. So just excited to try that with them as soon as I can. The other CEU courses that I've gone and taken, most of them have a lab, but we're practicing these techniques on other therapists who don't have the impairments that the population that we're actually learning about. So being able to use a patient to practice those techniques was one of the best things that I felt really helped me be able to apply and know what the movements were going to actually feel like, because it's different when you have a patient and you're feeling those movements and how they are than when you're practicing them in the lab with another therapist who doesn't have those same restrictions or impairments.
So what Wesley was just doing was the slips and trips research, which is basically showing why after somebody has a fall and learns how to correct it, that they can keep their balance at home. But one thing that I learned about that was new to me was error augmentation. And what that is we used to think that in order for a patient to learn a new skill, we wanted them to practice it perfectly. And what we now know is that through the process of making errors, patients can actually learn how to recruit the right muscles and correct their own errors. And so what we'll sometimes do is make the error a little bit worse, and we'll maybe add a weight to it or put them off a little bit more off balance. And when we do that, the patient corrects their own balance or pulls a little bit harder, and that recruits those new muscles. And so when we remove that stimulus, all of a sudden it feels really easy to do it because they've been recruiting all those extra muscles. With Charlene over here, we noticed that while she was walking, she was having trouble lifting her left foot up. And so what we did is we added a 7-pound weight to that. And it seems counterintuitive because when you add that weight, it seems like it would be even harder to lift it up. But every time she had to lift it up, even with a little extra help initially, she was pulling on all those muscles that much harder, recruiting more fibers and using them more actively. And so when we pulled that weight back off, all of a sudden she was able to lift up that foot so much more easily and was taking longer steps and bigger steps without her foot dragging on the ground.
This is what Wesley talked about, is how a patient reacts and behaves when they have a true neurologic deficit is just different than a person who has a fully intact neurologic system and is trying to replicate that, but how they replicate that type of symptom is just different from someone who has that actual impairment. Obviously, we have patients here who are acutely recovering from a neurologic injury, and our goal is to not just get them better, but in an optimal fashion using the latest evidence-based practices, what is supported in research and science.
I'm satisfied with the progress that I've made, and I've come a long way. My left side was immobile, and these folks here have given me a new lease on life.
You're great. You're awesome. Okay? I'll see you tomorrow.
Keep it up.